Hey everybody, welcome to Atlantic Health Systems Community Conversations. My name is Luke Margolis. I'm the Corporate Communications Director for Atlantic Health. And today, he's wearing a mask, so I'll introduce him, but he probably needs no introduction either way. We are talking, of course, about Dr. Mike. Dr. Mike Varshavski, a family medicine doctor with Atlantic Medical Group and with Overlook Medical Center and Chatham Family Medicine. Dr. Mike, a huge title. Thank you so much for chatting with us today.
Yeah, thank you so much for having me. I'm excited to talk about this. I know there's a lot of confusion.
Yep.
Folks want answers. Doctors should be giving answers, and I think this is a great way to begin that conversation in order to decrease some of this confusion and hopefully give people some guidance in order to protect themselves and their family members.
Awesome. We're going to give about a minute for folks to kind of fill the virtual room, if you will. This is a subject I'm sure you know all about. And while we do that, I'll explain how this will work. Dr. Mike and I will chat for about half an hour. We're going to go over a couple of topics, some of which we've already, if you've seen our emails or the social promotion around this, know some of the subject matter anyway. But we are encouraging folks to ask questions, share some thoughts. Do that through Facebook, and of course we'll have an opportunity to touch on some of those hopefully as time goes on. And then if you are not able to stay the whole way through this conversation, the entire thing lives both on our Facebook page, on our YouTube channel, on LinkedIn, and now for those who are interested in checking it out as well, on TV, on News 12 Plus on the weekends at 8:30 on Saturdays and Sundays. So that is the run of show, Dr. Mike. Let's jump into it.
Let's jump into it. Let's do it.
Cool. The topic that we're discussing, the main topic we're discussing today is this, well, frankly, look, if you're a parent, kind of scary news, that a lot of the increase in cases we're seeing in COVID-19, both in New Jersey and nationwide, are amongst an increasingly younger age set of individuals. And first, what do you think that says about kind of where we are in this fight against COVID? And then we can kind of tuck into some of the motivations behind that. What's your reaction?
Absolutely. In order to not scare people and not to increase anxiety during a very anxious time, to keep people, as I say, alert, not anxious, it's important to say that while it's increasing in young people, it's not increasing in children. So we still see really low numbers of children being infected with this virus. We see low numbers of hospitalizations. And I want parents to not think of this as a major red flag, but some general information that they should know moving forward, and to sort of get a sense of what our theories are as to why younger people are getting it. And when we say younger people, we generally mean those under the age of 40. Because initially, when COVID first struck, the hardest hit community was those over the age of 40.
That's right.
The death rate in those over the age of 50 is much higher than that if you're below 40. So we in the medical community have been trying to hammer home to those over the age of 50, stay home, make sure that you're limiting your risk as much as possible, much more than young folks. And then as time went on, I think what happened with young folks is they developed something known as caution fatigue.
Caution fatigue. Okay.
Caution fatigue. It's basically, we actually have something similar to that in the healthcare space called alarm fatigue. And we've tried to address it where if you have a monitor that's constantly beeping, giving off alarms, if it's doing it like it's crying wolf, when it's doing it too much, our brains stop paying attention to it, and that's dangerous.
Like static, kind of white noise kind of
White
thing.
noise, like, oh, that's just a beeping thing, don't look at it. But the purpose of an alarm, the purpose of caution, is to make sure that we catch things early, to make sure that we can step in and save someone's life or prevent an infection from happening. And what we've done in the healthcare system is try to decrease those alarms unless they're absolutely necessary. But now, with the COVID-19 pandemic, we've been giving so much guidance. We've been telling people to stay home, which is completely unusual and unprecedented for this generation, that they said, okay, we're tired of this. We want to get back. We want to get back to normal. We want to go back to going out, seeing our friends.
Get on with their lives.
Get on with their lives. And financially speaking, there's communities that have been so hard hit because they don't have a job right now. They're out of work. They have to feed their families. So we see young folks returning back to social activities, perhaps too soon, perhaps without following all the proper guidelines. We see young folks who've been the primary essential workers during this time. We take for granted the fact that we have Amazon delivery workers, the the United States Postal Service is still working.
Gas station folks in New Jersey.
Exactly. Those are not 60-plus individuals working because they're at high risk. These are young folks. So because of this, we're seeing them exposed to the virus in higher numbers than ever. And then something that happened in the beginning of this pandemic, we really urged people to save testing for those who really need it because we were short on supplies.
Sure.
That made a lot of sense. Now, as we become more liberal with this testing, even testing folks who are asymptomatic, meaning not showing symptoms, young folks who are not showing symptoms or showing very mild symptoms are going out to get tested for curiosity, to make sure they're keeping their family members safe. And that also adds to the high number of young people getting sick. So it's not strictly, because in media, we love to create some drama or hysteria and say,
narrative.
a narrative.
Yeah.
Young people are not listening.
Right.
There's a percentage of young people who aren't listening, but the huge majority are. And there's other reasons, there's multivariables why young folks are getting this. And I think it's important we talk about all those, like the caution fatigue, like the fact that they're essential workers, like the fact that we're testing them more than ever we had since the beginning of this pandemic. And I don't want to paint it with a broad brush. I want folks to know why this is happening and also understand the consequences, because I think that's really important to talk about.
There are, let's be honest, there are ways to do things safely, right? I mean,
Sure.
we know, just by virtue of the fact that we've been sort of coexisting with COVID for a couple of months now, that some of these public health guidance things that we were encouraging since the very beginning worked, right? So let's talk about a couple of those, and they're the main ones that we always talk about. We're doing some of it right now.
Sure.
Can young folks, if they stick within the parameters of these guidelines, do some of these things safely? Maybe not all of them, but if you had a couple of people gather together outdoors, are there ways where people can do some of this responsibly?
Absolutely. And I think whenever we talk about any kind of intervention, medical intervention, physical therapy, medication, surgery, even the recommended guidance of staying home, those are medical interventions. They always come with some sort of risk. And the goal of a physician is to balance that risk with the benefit, and always to try and get the most benefit while limiting risk. And now we've come to the point where if we just keep America shut down completely, we are now increasing the harms and really getting limited benefit return on that.
Sure.
So we absolutely have to start getting people back to work, doing a phased quality reopening where we're monitoring what happens, constantly reassessing, getting new information, giving folks the right guidance so that they can return to work, to their normal social activities. Because isolation for the human mind is toxic. There's no other way to say it. So we absolutely need to return back to normal, but we need to do it smart. 6 feet of social distancing, great first step. Wearing a mask, another great step. Washing your hands thoroughly, another great step. And these are really pieces of guidance that have evolved over the last few months because we're learning. And a lot of folks want doctors to have all the answers, and the truth is we don't.
Right.
We do not have 100% certainty on almost everything that we recommend in the hospital space, and that's why I don't want folks to get frustrated. When initially this pandemic started, even the Surgeon General was saying that folks shouldn't be buying masks.
That's right.
Because they were saying, there's a shortage of masks
Even for the healthcare
for healthcare professionals.
Yep.
There's no evidence that a surgical mask will protect you. Those are true points. What we didn't know, and what we're learning now, and why we've changed the guidance on masks, is that asymptomatic or pre-symptomatic, meaning folks who aren't showing symptoms right now, but perhaps will later, can be spreading this virus rapidly.
Right.
And with COVID-19, the real danger of it is that it spreads 2 to 3 times faster than influenza. So it's not like it's such a deadly virus that if you get it, that's it. No, in fact, most people will do quite well with this virus, mild symptoms, especially if they're younger, low risk factors. But the fact that there's a percentage of people who will have severe cases, who will need oxygen support, ICU support, and it happens so quickly that it can overrun our healthcare system to the point where our ICUs are filled and cannot deliver care.
In parts of the country right now.
Exactly, yeah.
So I want to touch on something that we have, we talked about it a little bit before, some of the downstream implications for folks when they contract COVID-19,
Yeah.
especially as it relates to young people. Despite the fact that some young people may do just fine with COVID-19, many young people may put others at risk. So I guess I'm wondering, can we touch on a little bit of some of the implications?
Yeah.
Maybe it might be this kind of concept of it's not so much about how it affects you, but how you affect others.
Yeah.
How real of a threat is that, especially for families where there's maybe multi-generational
Yeah,
folks?
that's a really good point, because when I talk to my young patients or even my social media subscribers, they say, well, I'm young, I should do well with this virus. And while there's truth to that, there's also truth to the fact that as a young person, you could be the super spreader that gets your grandparents sick, your family members sick, the people around you at your job sick who may not have a great immune system, who may be over the age of 60. So you could potentially be the one spreading this virus, number one. And number two, ICUs in certain parts of this country are already functioning at near capacity, that even if a small percentage of young folks start getting sick out of nowhere, that can overload the ICUs where they can't deliver care at all.
Sure.
Because the ICUs are the backbone of this country. We need to be able to deliver trauma care, cancer care, infusions. This is crucial to running the economy, the healthcare system. Everything starts with health. And if we can't deliver that because young folks are going out in droves and not socially protecting themselves, that's going to be a huge letdown because it can make the COVID situation a lot worse.
Now, the good news is here in New Jersey, obviously, we've gotten things in a much different position than where we were back in April. And we're at the stage now where we're encouraging folks, and have been for weeks now, to not delay essential care so that they can come in. That's tied to a larger issue that I want to spend a little bit of time on, if you're willing to. And that's about the importance of clear information transfer as part of this, making sure that folks have the information they need. This is something you have done quite a lot of work in recent years, and something that frankly you're known very well for. And so I want to talk for a little bit, if we can, about trusted sources of information, how you identify those, and what are some of the things that you try to do when you convey information through your YouTube channel, through Instagram, online, which so many folks really have turned to you for information. How have you been able to navigate those waters, and how do you do what you do?
It's really a unique situation that I find myself in, and I'm quite blessed to be in this position, where at the beginning of this pandemic, people came in droves to my social media platforms looking for answers, because they knew we were the place where you're going to get honest, unbiased information and use that information to sort of guide you in your everyday life. And this has expanded from checking what politicians are saying, what the media is saying, even interviewing Dr. Fauci on our channel. He gave some great answers. We saw eye to eye on many issues. And I think all of this points to the broader point that healthcare professionals, be it a nurse, a doctor, a physician assistant, we need to do better in communicating to the general public. We do a good job when we're trained to do a one-on-one,
That's what we're doing here, right?
Yeah, with our patients, like if you're in a room. But we also need to know how to speak to everybody, to people who may not have a lot of healthcare knowledge, who may be really untrusting in the given moment because of what's going on around them. There's a lot of conflicting points out there. So what I've done is try to create this medical content in a relatable way, easy to understand way, and most importantly, in an influential way. I think doctors are really afraid of being labeled influencers or marketers. And that happened because a lot of times doctors would use that power of influence or marketing to sell less honest things, miracle supplements, cure-all products. And that's not what I use this influence for. The influence is to get young people to socially distance, to wear masks, to take their medications, to see their doctor for their preventive care visits. That takes a tremendous amount of skill, and it not only improves the quality of life of that individual, but it also has downstream effects of economical benefits, of decrease of a pandemic spread. Because if 6 million people watch my Dr. Fauci interview, that's 6 million people who are well informed about what to do moving forward.
There are a number of resources that we've linked to on our website, atlantichealth.org, that specifically the CDC, NJDOH, things along those lines. And of course, through content that we produce, like what you're joining us for here today. As it relates to pursuing information online, what are some characteristics that folks can look at to, do you find those trusted sources and then you can rely on the credibility of that information? Are those good rules of thumb to find those large organizations, those governmental organizations like that to trust?
I think to stick with the major organizations like the CDC, the WHO, that's going to be your best bet for most accurate and up-to-date information. If you happen to come across a claim on social media that it triggers you emotionally to want to share it or send it to one of your friends, the piece of advice that I've partnered actually with the United Nations to put out there is pause and take care before you share. So give your brain that little 5-second break to kick on its rational thinking, and you'll suddenly see that blow drying your nose with a hairdryer is not going to kill this virus. It's going to do you more harm than good. Because we're all susceptible to emotional thinking. That's what we are as humans. But if you just give yourself that one pause, you'll allow yourself to have a higher chance of critically thinking and decreasing the spread of misinformation. Because honestly, we're all a part of it.
So I want to touch on some questions that we're getting from our audience. A couple of them have to do with this concern around schools and safety.
Yeah.
We're going to be chatting in a couple of weeks with a pediatrician with Atlantic Medical Group, Atlantic Health System, Dr. Tyree Winters, and we're going to talk a little bit more about immunizations and some other school-related issues there. But I wanted to ask you the same question.
Yeah.
What are your thoughts about how young folks can return to school safely? Some things that they need to keep in mind as we talk about in-person class resuming. Not everywhere in the country, because some places have said they're not, but some places in New Jersey certainly are, and some places around the country as well. So what's some broad guidelines you think?
Yeah, this is a really important topic to touch upon because you have multiple parties involved in this situation. Those who are employees at a school, teachers, custodial staff, then you have the students, and then you have the other group of people, which is the families of the students. And each of them face unique challenges and risks with schools reopening. And what we have to do, basically on a federal level, is to hear out all of these parties. And right now, with the rise of political polarization, what we're seeing is actually a disconnect in that level of communication, a disconnect in the level of trust. And when what that happens, you have less collaboration. And with less collaboration, there's going to be miscommunication errors galore. There's going to be folks who are thinking facts that are not true. They heard something and now they want to believe it, and their emotional side, it spreads like wildfire. So I think we need to think about schools in this manner. And I actually had a pediatric ICU physician on my YouTube channel interviewed yesterday that's going to go live this Sunday. Schools need to reopen. Kids need to get back to school. Does that mean there's a one-size-fits-all solution? Absolutely not. Every state, every municipality is going to have a different set of guidelines on how to return. Mostly because the numbers are different, the funding is different, and the amount of folks sick with COVID in the given time when schools open is going to vary drastically. So there's no one-size-fits-all solution. It's going to change broadly. And then the next part of it is, when we're reopening schools, we have to be adaptable and ready to pivot. Basically, in medicine, whenever you do any kind of medical intervention, it's not patient comes in, you label them with this diagnosis, you give them this treatment, you're done. No, you have to do a reassessment. So either they come back in, they call you, you call them to see if the treatment worked. Same thing with reopening schools. We have to reopen. In some areas, that's going to mean different things. But once we reopen, we see what's happening to the numbers. Are teachers getting sick? Are students getting sick? Is this having more negatives than positives for the community? And only then will we know the truth.
What's for students who are going back in? I mean, obviously there's going to be a lot of pressure, masking, hand washing, things along those lines. But it's probably easy to backslide amongst those best practices when you're around folks who may not be as enthusiastic about those kinds of things. How important is it to make sure that the adults in those situations are reminding the kids to do those things?
I mean, it's incredibly important. We have to stay on top of kids. 10-year-olds don't listen well. They need sometimes that layer of discipline.
I
So
can speak to that.
it's going to be a lot on teachers. We're giving teachers a monumental task. They're essentially becoming the frontline workers that we were in the beginning of this pandemic. And it's scary. It's scary because there's a lot of unknowns. And while the initial information is promising here in that kids are suffering less with this virus, they are spreading it less, that's just preliminary information. That can change, and that's why we have to do this reassessment and be ready to pivot.
Goldie has a question. She's 19 years old with moderate asthma. Respiratory condition can be a frightening thing to have. I mean, essentially her question is, how concerned should she be about COVID-19? But in a broader sense, what's a person in a situation like that best served doing during this time?
I think my piece of advice that I said at the beginning of the pandemic would really apply is to stay alert, not anxious, because the more concerned and anxious you get, the less you're going to be making good decisions, quality decisions. There's really been conflicting data about asthmatics and COVID-19, whether or not they're having worse cases. So I wouldn't say you should become really anxious and follow the strictest guidelines as if you're over the age of 65 and have an immunocompromised state, but you should be taking more precautions than the average healthy person, simply because there is that possibility, there is that chance, but definitely not getting anxious.
As a physician, what have you been hearing from your patients when you speak with them and when you see them, and what has been sort of the general tone? How have people come in to Chatham Family Medicine concerned? Are you hearing from patients with a heightened sense of anxiety? And if so, how are you articulating your advice to them? Is it as much a reassurance as it is a guidance thing? How have you been balancing?
You know, it's really an individual decision on how we approach each patient, because some folks need reassurance to decrease their anxiety levels, but other folks need to be sort of snapped into reality and say, this is a serious situation, don't take it lightly. So it obviously applies differently to each patient. That being said, the baseline level of anxiety in New Jersey and my patients, and frankly in the world, is at an all-time high.
Yeah.
Folks are really anxious. And what's interesting is the anxiety is not just presenting itself surrounding COVID. It's affecting other areas of their life where they're not even associating it with COVID, but the COVID is the one that's keeping that flame burning for them.
Sure.
So my goal has been to decrease this level of anxiety by having them talk about these situations, arming them with the best information at hand. And really, some of the biggest confusion on a day-to-day basis has been around testing. Whether or not they should be tested, should they get the antibody test, the diagnostic test,
Right.
and that's sort of the guidance I've been giving not only on my YouTube channel, but to my patients as well.
Have you seen a major difference in that? I mean, you mentioned those two different sides. The latter, snapping people back into realizing how dangerous this the pandemic is. Does that tend to be more where some of the interactions you've had online tend to be, or am I sort of projecting unfairly onto the social discourse?
No, I think what happened initially is media really lit a panic in folks. They were throwing outbreak warnings every day, new high, this and that. But when we look back at it, to the numbers that we have now, this is the real high.
Right.
But now media is over the scary outbreak story. So in the beginning, I was giving a lot of reassurance, the stay alert, not anxious message. But then 2-3 weeks ago, when folks were seeing a lot of protests on television, whether it was for social justice matters or for not wearing a mask in public,
Sure.
they saw this on television, they assumed it must be safe to go outside. So I actually had to tell my audience, I'm here to fearmonger you right now. You have to take this seriously. And I'm usually the one extinguishing that fear. But I had to reinstill that because I saw what was happening. And I think that's what a quality physician does. They don't just put out information without an audience in mind. You have to understand what's the purpose of your message, who's going to be hearing it, and how can they hear it in a way that's going to be effective.
What's been your reaction to some of the increase we've seen in social activity amongst young folks? I know that, it's funny, I was even returning home from work yesterday. I drove through a part of town near where I live that I hadn't been through in a while, and to see people out dining outdoors,
Yep.
It was like, you can't help but say to yourself, wow, social interaction. How much we miss that, how much we all want those types of circumstances to come back to normal, and that pull is especially hard, I would imagine, amongst younger folks. What's been your reaction to some of the increased social activity we've seen here? Some of it has been done with masks, some of it not so much. What's your guidance to folks as they look to return to a more healthy social life?
I think you have to balance the risks for yourself. People will ask very specific questions. Can I play a musical instrument around someone? Can I go to this local bar? Can I go to this restaurant? And really, it's about risk management for yourself as a person. And if you can't quite figure it out on your own, talking to your family medicine physician is a good start. The Texas Medical Association actually put out a great chart of rating things from the lowest risk to the highest risk based on activities. Running alone, running with a partner, being in a social activity with a large group of people being one of the highest risks. But it really just depends on what risk level is acceptable to you. And this goes back to our initial conversation of young folks being sick more with this now. Young folks are more risk tolerant. They're more liberal with their risk taking.
Okay.
Partially that's being young and not knowing all of the risks. Partially it's hormonal. Our raging hormones actually do play a role in the way that we take risks. And we have to be understanding of that and constantly reassure, give that guidance to make them understand the implications of their decisions.
The interesting concept of anxiety, we talked about it a little while ago. We actually did another community conversation if people are interested with Dr. Peter Bolo, chairman of psychiatry at Overlook Medical Center. All right, so he was fantastic. Everybody loves Dr. Bolo, and he talked about the differences between anxiety and depression. But amongst young folks, how much do older people need to take responsibility for keeping an eye on younger folks as it relates to anxiety and that level of concern, and how influential can older individuals be with younger folks as far as balancing that anxiety that people feel?
I think I would like to see people who are older to try and reach out to younger folks through technology. I know we may not all know how to use FaceTime or Zoom or Skype, but put that effort in. And if you can't go see your loved one because you're worried about the potential effects of an infection, call them. talk to them. Have a scheduled time where you're going to do that. Because the main thing that causes anxiety with this pandemic is the breakup of our routine. In fact, the routine is non-existent, right? Kids don't have to be up for school, so they go to sleep at all hours of the day. If you don't have to be at work at a specific time, so you go to sleep at 4 a.m. When you lose this sense of routine, it loses a sense of normalcy, and you get a spike in anxiety. So if you can be the adult, try and set a routine for your young folks. Call them at specific hours where, we're going to have a meal together, even though we're doing it through the phone because we can't see each other because we don't want to risk this infection. But it's something that's easy to do, doable for everybody, and will make both parties feel that much better.
Are there anxiety is a health concern, but are there physical concerns to throwing those routines off? We talk about the importance of sleep, and
oh my God, yeah.
And in fact, I think you recently did a video about the importance of sleep.
Yeah.
Can you talk a little bit about those physical health implications?
Yeah, changing your routine, having a spike in anxiety really affects you physically. I frequently talk on my YouTube channel about the fact that the mind-body connection is not mind and body, it's mind-body. So anything that happens mentally to you will have physical downstream effects, and likewise in the other direction. So if you're not sleeping 7 to 9 hours a night on a consistent basis, the same 7 to 9 hours, that's also really important, you're going to have negative effects where you're going to be running on adrenaline. You're going to be running on what's known as the sympathetic nervous system, the fight or flight response. And what happens during that is you may perform okay, you may get through the day, but you're not resting, you're not digesting, you're not healing well. And when that happens over a chronic period of time, a long period of time, you get really bad health outcomes. You get increases in heart disease, stroke risk, cancer risk, even depression rates, suicide rates go up. And that's been a big concern for psychiatrists and psychologists alike, because we know that when you have folks without a routine, they're not going to be sleeping well. They're going to be socially isolated because of the quarantine. These rates will go up, and we have to have a plan in place to help those individuals out.
We've gotten some questions online specifically about teens and the way that the COVID virus has spread. There are undoubtedly, now that we are in the summertime, and although we're sort of, unbelievably enough, in the latter half of the summer at this point, but what can parents recommend to their teens about the social interaction they're having with each other? We have, whether it's your neighbors coming over and wanting to play pickup basketball,
sure,
or socially gathering outside where those who can on lawns or in public spaces or in parks. What are just some simple rules of thumb and guidance that folks can share to say to their teens, look, don't trust me, listen to Dr. Mike.
Yeah.
He's provided this guidance.
Yeah.
What's some rules to
There's 3 factors that are really easy to focus on. One is where this is happening, the environment. So we prefer outdoor activities to indoor activities because we see the spread is less outdoors than it is indoors. When there's wind, there's humidity, there's sunlight, there's going to be less viral transmission. It's not totally non-existent, but it's lower because this is all about managing those risks. 2 is the number of people around you. It's less risky to have one individual come over and visit you than it is to have a group party of 50. In fact, that's what we're seeing the biggest danger in. People having group parties and then 30 of those 50 individuals get sick because one person was sick. Right. It's less impactful in a community where one person gets one person sick, a lot worse when one person gets 30 people sick. Because then those 30 people go into the community
and they do that
exponentially. Right. Exactly. And then the final one is time. How much time you spent doing these activities. Because it takes some time to get infected with this virus. It's not like, oh, I just walked by somebody, that's it, I'm going to get sick. It's not a sci-fi movie. It takes some time to get sick. And that time factor is also important, not just with friends or social activities, but also for things like going to the grocery store, trying to keep your trips short. If you need to go to the salon, get a haircut instead of a haircut and a color because you're going to be spending more time there. If you're going to be getting a manicure, get the shortest version of the manicure. I'm not an expert in this, but I know that there's different acrylics and gels that you can do that take a longer period of time. Because you're increasing time, because you may need 2 people to work on you, you're increasing time and people. And whenever you increase those 2 factors, you're going to have a higher chance of getting sick.
All right. Now, for those of our audience who are experts in those spaces, if they want to chime in, by all means,
please teach
help
me.
us out. We can use the information. The dynamic of, and it's funny, a lot of the questions we've been receiving on Facebook, not just in this episode, but in the ones that we've started in weeks past, have been from older folks wanting to interact more with younger folks in their lives. Grandparents wanting to see their grandkids. Parents whose kids may be at college, and then initially the classes have been canceled, they're coming home, what do we have to worry about? And as school begins anew, it raises up a whole new level of concern. for those older generations who want to be around those younger generations, how important is that family dynamic and that family interaction? And what do you recommend? Is it best that those things happen virtually for the time being? Or when can we start to talk about redoing that?
Again, it's about reducing risk as much as possible. If you want to reduce risk completely, you do it virtually. Can it be done? Is it completely one-to-one the same as seeing them in person? No, absolutely not. But if you're truly wanting to minimize your risk to zero, you do it virtually. The next level would be, if you want to do it very scientifically, would be to have a young person get tested if you want to see them. And the important part is get tested, but then as they're waiting for their results, to quarantine themselves away from others.
Don't just get tested and then run right back out.
Exactly, because quite often what happens is someone comes into my office, they want to get tested to see family member X, grandma, grandpa, and then they say, okay, when will I have my results? I'll say 2 days, 5 days, whatever it is, and then they'll go back to life as normal waiting for the result. But you could just as easily get sick walking out of my office, walking to your car, and then that test is useless.
Right.
So if you want to get tested and then quarantine yourself, that's also an acceptable way of doing it and making it happen. And then there's also ways of doing it outside where you're not hugging, you're staying as far away from each other as possible, everyone's wearing masks. That's also doable, but again, you're increasing the potential risk. It doesn't mean it's the worst thing, but you have to know that risk exists. Look, we cross the street every day with the potential risk of an accident happening, but we accept that risk because we're aware of it. Same thing here.
Dr. Mike, as usually happens in many of the online stuff you do, we get far more questions than we have time to answer all of them.
Yeah.
But I appreciate you joining us on our Atlantic Health System community conversation, because I think we have hopefully helped inform some folks out there, and appreciate you taking the time to chat with us today.
Absolutely. Thank you so much for having me. And for those of you at home, I want you to stay alert, not anxious.
Good advice. If you want to learn more about Dr. Mike, you can go to atlantichealth.org/Dr. Mike. We've got information there. You can also go to Find a Doctor on our website, atlantichealth.org. This community conversation lives on our website, on our Facebook page, LinkedIn, and on News 12 Plus. I'm Luke Margolis. For Dr. Mike, family medicine physician with Atlantic Medical Group and Atlantic Health System's Chatham Family Medicine, thank you so much for joining us, and we will see you next time.